cover page. Next slide, please. Our topic is the relationship between electronic device usage, duration, and physical fitness of secondary school students in Hong Kong. Next slide, please. For background, electronic devices are common in secondary school students. Electronic device means a personal computer, cell phone, smartphone, telephone, mobile device, wireless device, tablet, or any other electronic device that allow people to access the services. The usage of the electronic device of them are mainly communicating with friends, entertaining, education. For educational usage, e-learning is more common among secondary schools nowadays. They are required to use tablets during the lessons. It significantly increases the usage of the electronic devices. They may need to check the dictionary or finishing their homework online. Some of the secondary school students require the students to hand in their homework through Google Classroom. The Hong Kong government promoted the students to use the electronic device for educational purpose. It provides funding to students to buy the tablets from 2018 to 2021. This scheme encourages students and secondary school teachers to use the e-learning for education. They also provide subsidies for students accessing the internet for those who are needed. They usually prefer using electronic device rather than doing exercise. It will negatively affect their physical fitness and physical health status. The abnormal BMI reading is found among secondary school students. In the school year of 2019 and 20, there is over 20% of secondary school students who are overweight and obese. Next slide, please. For significance, the likelihood of problematic smartphone use increases and leads to negative health outcomes. Second, the longer duration of smartphone use was associated with lower physical fitness in a 50-meter sprint and 1,000 meters run. For problem statement, from the previous studies, they focused on the impact of using the electronic devices amongst university students. Some of them only mentioned about the mental health of university students. In this study, we will be focusing on the use of electronic device and the relationship between physical fitness of secondary school students. Thus, our study aims to explore the relationship between electronic device usage, duration, and physical fitness of secondary school students in Hong Kong. Next slide, please.
About the research question, what are the secondary school student usage pattern of electronic device in Hong Kong? Is there a relationship between duration of using electronic device and physical fitness of Hong Kong secondary school student? Is there a relationship between use of electronic device and physical fitness among Hong Kong secondary school students in male and female? Hypothesis: students who have higher usage of duration of electronic device have a lower physical fitness than students who were not. Study purpose is to describe the relationship between duration of using electronic device and physical fitness of Hong Kong secondary school students. And the study objectives, we will first explore the usage pattern of electronic device among secondary school students, then record the physical fitness data of secondary school students, and identify the relationship between the use of electronic device and physical fitness among Hong Kong secondary school students in male and female. Next page. Our research design is quantitative research. The first rationale is efficiency. Quantitative research allows us to obtain the data of many people in a short time. Second, it is cheaper. It is inexpensive with a fixed amount of funds and time. Third, anonymity. A great guarantee of anonymity can be crucial in obtaining candid response to sensitive questions. Fourth, there is no interviewer bias. About the research method, cross-sectional and correlational design will be used. This method is efficient that can deal with a large amount of data. It's also strong in realism and help us to find and understand the direction and the string of each relationship. Next page. Simple random sampling is easy to conduct. We don't need to divide the population into subpopulations or take any other additional step before selecting members. We simply select a random number of people from a total population. Group representation, because the smaller sample is generated randomly, it is gradually assumed that the group is representative the entire population of participants in expansive, because we are simply putting names from the existing population. Unbiased, the technique gives every participant a fair chance. The result sampling is unaffected by research team. convenience, it is randomly selected from people from existing list. About next page, about questionnaire. Saving cost is cost efficiency approach. It can gain response quickly as it is easy to collect result. Scalability as it can obtain information from large audience. Response anatomy is provided truth so people will be more honest to answer the question. Physical fitness test, it increase investment because it increase the motivation between the student and they can move in the playground. It is attractive and compare again a small group. Pass the time to the next group, mate.
As to sampling, we decide our study site is a playground of a secondary school in New Territories, and the school is mainly promoting the development of student talents in sport. Our inclusion criteria are that students are studying in the specific secondary school and they have mobile phones. It's because this study have a large relationship with mobile phones. Also, as our questionnaire is written in Chinese, so we hope the student can be able to speak and read Chinese. As for exclusion criteria, we hope it can strengthen internal validity. So students who are disability, having respiratory and cardiovascular disease, and have done a surgery within 1 year will be excluded. Because this factor may affect the physical fitness. Also, students who has mental illness may have difficulties in understanding the questionnaire or the whole procedure. Lastly, students use mobile phone less than 30 minutes will be excluded too. We will mention in the information sheets that we do not encourage this student to participate in this study. Next page. In the simple random sampling aspect, we will do a random draw from the student name list. To get the name list, we will introduce our study purpose and procedure to the principal for requesting approval. Our minimum sample size is 384. We calculate it based on 5% of margin of error, 95% of confidence level, 324,927 of population size, and 50% of response distribution. The population size is according to the total number of all ordinary secondary school students from the student enrollment statistic in 2021 to 2022 of Education Bureau. Moreover, there are 510 ordinary secondary schools and our accessible population is about 640, and it is the number of students in one secondary school.
Then I'm going to talk about the data analysis and the data collection method. First, we decided to use questionnaire and the physical fitness test to collect data. For questionnaire, it is a self-report method. We only use it to get a demographic data. It contains about 7 questions, like sex, BMI, grade, and we may have a question to assess the duration of use electrical device by using the following question. How long do you always use smartphone in a day? They will answer in a minute of using electrical device. If the student did not know the exact duration of the smartphone use, they will be asked to check the screen time on the smartphone. The total duration of it will calculate from the student response. Then the report daily duration of smartphone use will divide it into 3 categories, short, medium, and long. Next, physical test is based on school physical fitness award schema. It have items like sit up, sit and reach, 9 minutes run, and push up and hand grab. And next, data collection procedure will be held from 1st of July to August in 2023. We may approach to potential participants after school approval and after random draw, and then we may go to the contact those selected students. Trained researcher will carry out a formulation session in a playground, explain the procedure and the purpose of the research, and administration the questionnaire and do the test with the physical education teacher. And participant information sheet and consent form will be given, and the questionnaire is written in the Chinese and it's about 5 minutes to complete, and it conducted before the physical fitness test. And the physical fitness test will need about 30 minutes to finish. All tests will perform once only, and for the data analysis, next. Data analysis will conduct with the SPSS statistical software. and descriptive analysis will perform on all variables, means for continuous variable like duration of smartphone and the BMI, and the percentage for the categorized variable like sex and grade. And the subplural wheel test will be used to determine the normality of the distributed for the variable. Although the variables are normally distributed, but we set duration of the electrical device used as a categorized variable. So we use a supplement correlation coefficient to see the relationship between the electrical device usage and the duration and the physical fitness. Next, consider the difference in physical fitness and the smartphone use exists between men and women. All analysis will perform separate by sex. We may test difference between two or more group means. If the variables are normally distributed, we may use parametric test. First, we may use the unpaired t-test to compare demographic data like physical test item in two different gender. Then we will use an ANOVA test to find out if survey results are significant and help us to figure out if we need to reject the new hypothesis and tell us if the physical fitness change according to the different duration. And the level of significance for all analysis will be set at p smaller than 0.05.
Next, I'll talk about ethical considerations. The ethical approval is provided by the CAC Research Ethics Committee and the principal from secondary schools. We have provided the consent form and information sheet to the principal. Parents and children from the secondary schools. All the details of the studies are listed on the information sheet. We will need signature from both the parents and the children due to the reason of underage. Before the start of the test and questionnaire, participants have the right to ask questions and free to quit during the questionnaire and fitness test. All the procedures are in confidential and anonymity. Participants are voluntary to join the study. Participants know the purpose, benefits, and potential risks of the study before they join. The benefit of the study is participants can identify their own physical fitness ability. The potential risk of this study is participants can get injury during the physical fitness test. In the data store and anonymity part, data will store in a password-protected external computer and saved in a locked file cabinet in the office. The hard copy of the consent form and questionnaire will store separately. All the data can only read by the authorized staff members and researchers. All data will be deleted after the research. Numeric synonymous will be given and no identified information is needed from the participants.
For conclusion, we will use quantitative research. We will be using cross-sectional and correlational design. Our target group is New Territory secondary school students who use mobile phone and know how to speak and read Chinese. We will exclude students with physical or mental illness. We will use simple random sampling, and the minimum sample size of random draw is 384 students. There will be two data collection methods. The first one will be questionnaire for 5 minutes about the using duration of smartphone. The second one will be a physical fitness test. It will last 30 minutes and we will assess students' physical health condition. For data analysis method, we will use SPSS statistical software, Chaparral walk test, Pearson correlation coefficient, parametric test, unpaired t-test, one-way ANOVA. Next slide, please.
In the implication of the findings with respect to future research, we believe that the outcomes of this study will contribute to the management of students overusing electronic device effects to their physical fitness. It will also contribute to further research to investigate how to reduce the impact of overusing electronic device and investigate an appropriate duration of using electronic devices. The implications for nursing practice, we suggest that the effectiveness of these methods will be investigated further in the educating to various teenager groups and different age groups. It can reduce the time for intervention if the patient is overusing the electronic devices and affect his physical fitness. Here is the references.